I think this is the presentation we've all been waiting for. So what have we achieved and what have we done in a summary framework? I'm standing here obviously not as a single person, but on behalf of the whole Mood Consortium. And where is my, oh, here, yeah. Would like to start off with that I don't need to tell this audience that throughout the pandemic, we've been seeing different perspective pieces around the use of modeling to help inform pandemic preparedness, or not even preparedness anymore, because it was already there, but to help inform decision-making throughout the whole COVID-19 pandemic. And it started off, I think, a bit with, or not I think, because we've looked into the literature, but it started off with more educating both the public as well as decision makers to say, hey, models can't do everything, okay? Be critical, don't trust everything, and also know what they can and cannot do. Where I think also the classic scenario analysis, which we try to emphasize, is also continuously mentioned. Then it moved on a little bit more towards, okay, but where have models also been misused, and how are we going to prevent that in the next pandemic, thinking the pandemic will probably soon be over, which it wasn't. So then slowly more and more things became a bit towards the side of the science policy interface. So modelers have played a critical role. They are continuously playing a critical role. But how is our interaction actually with those decision makers and vice versa? I know Ruth McCabe and Crystal Donnelly have written a few pieces on this, which we've also used as inspiration for our work. And Mark Jitt lately, together also with Neil Hens, published a real nice piece highlighting a couple of critical points, which I would recommend to read. But in all those different endeavors, all of them are mainly commentaries, experiences from those modelers themselves, but also from the decision makers, sometimes combined. But none have really tried to kind of in a more systematic way quantify, okay, but what were actually really the needs? What were really the methods used? And how was then that interaction with the decision makers on which particular questions notably? And that is what we try to address with this particular survey that we enrolled, and most of you might have seen, or at least some of you. And with this survey, we aim to assess the evolution of modeling practices, data usage, data lacking, but also the uptake and nature of interactions on modeling work between scientists and decision makers. And this then to hopefully help inform in the future evolving data needs during a pandemic, as well as future investment in between brackets, non-traditional surveillance systems, technical skill sets needed, and the communication of models at the science policy interface. So how did we do that? So I already briefly mentioned it. So we distributed a semi-quantitative survey. First, we did a scoping survey where we tried to see, okay, what kind of things have been done, and more globally, what type of data used. And then we used a more quantified version where we had basically predefined categories, for example, for data, so we could analyze the data in a bit more of a rigorous way. We distributed across all the partners within Mood, and those ones involved in modeling. And eventually that meant we had 11 institutions involved with 66 responses, which all were then a modeling study basically that was intending to inform the pandemic decision making across 4 countries. And these mainly covered 3 different phases. So the first phase, you can't see it here. I had on the x-axis, I also had the timeline. But the first phase was basically the early phase, which was really when it all started and we didn't know what was going on. The mid phase was just after the alpha wave started off, which is around, I think from the top of my head, it's June 20, no, the end of 2020, I think. And then the last phase is starting post June 2021. So just so you have an idea also what kind of questions you might expect to be asked during those different periods. And what were the type of questions we then asked? Well, first of all, what questions did models address in the geoscope of those models, with what type of methods as well as data, and how and by whom were these data made available? but also, and we all kind of categorize these as the what can be done, basically, if you go back to my aims, then what data was not available and why, and were the approaches used also openly available afterwards, for example, with the code published on GitHub, which could give information on what can be improved on the technical side, and then also how did modelers interact with the decision makers, and did they also care about the same things, which is more around, okay, can we improve the science policy interface? So basically to go then back to the first component, and just to say, I have 10 minutes, so I can't present everything, but happy to elaborate later further. So what did the modelers predominantly address that filled out the questionnaire? So what we mainly saw is that, in particular in the early phases, was that we tried to understand what was happening and what is the COVID-19 dynamics, and try to address all these kind of questions around, for example, the role of asymptomatic transmission. So estimate transmission parameters, quantify COVID-19 burden under ascertainment, as well as the understanding of determinants of geospread. And it actually remained throughout the whole pandemic, because I think COVID was a bit non-classic, right? That we had all these different waves. This remained to be something that the modelers were engaged in. But a bit later down the line, which is not surprising, actually trying to understand the effect and trying to evaluate the different non-pharmaceutical interventions, but also vaccination became more important in the later phases, as you see in the light gray. I won't be going into detail on what type of methodologies were used. I just keep the figure there. But what I do want to then say is, okay, we've been implementing all those different questions and through modeling, but actually how applicable were they? And what you can see is that many of the studies conducted were mainly meant to inform national decision making, but actually predominantly from the UK and from France, you also saw that quite a lot of the work was also applicable on a global level and was also informing decision making on a global level. I hope you can understand the Alluvia plots, because I always have to kind of take some time to get my head around it. But again, happy to elaborate on it later. Then what type of data did the modelers need and what did they use? What we basically saw, and that's also what you can see, do I point here or here? Here? Oh, yeah. What you can see is that, and you see that here with the light green, that throughout the different phases, the traditional data sources, where you can think of case line lists as well as incidence data, remains a very important source to help inform those models. But what is also critical to point out is that what was often listed as a limitation of the data overall was that there was a lack of the right stratification in those data, for example, age and sex categories, but also the geographical coverage, which is something to bear in mind. And that what was also striking is that the data missing kept on being for more than 50% of the studies throughout all the different pandemic phases. So it wasn't necessarily that later down the line we thought, hey, now we finally have all the data that we need. And what was actually the notable data missing, and that's a plot you see at C, basically. You see that it was really kind of quite predominantly the real-time social contact data. So the pre-pandemic social content data was frequently used throughout the different pandemic periods, as you can see here, but actually more real-time, which is also kind of, more helping inform the actual behavior in real time, kept on being an important source missing, as well as serological data. And I think that's also something that Neil Hans yesterday touched on. And what was then the main reasons what were the main reasons listed as data missing or data lacking? Well, this was mainly because data didn't exist, for example, those real-time contact data, but also privacy and ethical issues, that there was just no access to this data because of certain constraints. Now, did modelers interact? And if so, did they also align with policymakers? This plot, again, you have to get your head around also a little bit, but one thing which is quite easy to understand is on the top, you see on the left-hand side, you see basically with what frequency, these are non-exclusive categories, but with what frequency the different studies were also either were they prompted by public health decision makers, were they influencing, according to the modelers themselves, the scientific understanding, so the awareness basically, and did they support public health recommendations according to the modelers themselves? So what was good to see, I suppose, is that for 62% of the studies overall, we saw a direct interaction with policymakers. So it was reported there was a direct interaction with policymakers, and it was also prompted by them. And in a separate question, we also asked how was that interaction? And what was interesting to see, and I think also something we saw in many countries happening, was that it was first more a direct interaction, just to basically get knowing each other, calling each other, these kind of things. But then eventually became more towards advisory committees, which were put in place later down the line. Additionally, 77% of studies was also reported to inform official recommendations. And as you can see at plot number C, so what we've done over there is that we've taken the ratio between the studies overall versus the studies that were either in either of those three categories. So for example, if we take the ones that were mentioned to help improve awareness, the idea is that if they're on the right-hand side, then particular themes were more often listed as to help improve awareness. And when there's a dark circle around it, that means that it was basically a significant difference. Yeah. And one thing which was interesting to see is that if we take, for example, whether they were prompted by the decision makers or not, then we don't necessarily see a significant difference for any of those themes. So this might mean that it wasn't necessarily that there was work done by the modelers, which then was considered not on the radar at all of the public health decision makers. So what can we conclude from this? And I feel at the moment these conclusions are a bit naive, and I'd actually like to take this moment to also discuss a bit further with you and interact with you what you think should be added here. But a couple of conclusions I want to say is that this study highlights that there's an evolving data and analytical need throughout the pandemic. And I think that's totally in line also with some of the work that has been published, among others by Johnny Polanski, where he shows basically the outbreak analytical framework, and shows basically through different phases in a pandemic you have different needs, which was exactly what we're seeing also with the type of questions addressed throughout the pandemic. As well as that the reported lack of, again in between brackets, non-traditional behavior and mobility data, as well as serological data, even after 2 years in the pandemic, that it underscores basically that there's a need for improved data collection and data sharing, but also rethinking of sustainable data collection from those that are provided by non-public organizations. For example, the Google mobility data, which has ceased at the moment and is not accessible anymore. And in kind of thinking around the data collection and that also standardization of the data, would it be helpful to have these kind of like protocol ready endeavors or protocols ready for studies like the REACT study, which collected in the UK very valuable serological data, as well as the COMIX data that Neil yesterday was presenting, and then use, for example, existing community platforms like InfluenzaNet, where you also interact with the public to provide some of these data. So there's two different things, right? The protocols, but also a network to enroll these things very rapidly during a pandemic. But also, should there be more funding structures for new initiatives, like, for example, Global Health, which is currently heavily used for the mpox, understanding the mpox dynamics in real time, but also the WHO epiparameter community, which is trying to collect from literature ready-to-use epiparameters to help inform those models. And then finally, and this is a bit of a conclusion, which is like, okay, we have a toilet product and we also think it's the greatest toilet product, but that it seems actually that Mood has been able to also reach out to policymakers and interact with policymakers, which has helped also inform decision-making. Some further considerations and limitations. First of all, Mood modelers might not necessarily be representative for all of the modelers globally, but we do think we had quite an extensive reach, also because that's how the model project was set up, or the Mood project was set up, but that it was really limited to countries where modeling also played a significant role. But also that the uptake was self-reported, right? And there was actually a recent study, which was from Sabine van Esseland, which has used the Overton database, which is a way to kind of measure the actual usage of data, which we could also be doing with our studies, to see whatever Imperial College did, to what extent was it also used in an official recommendation. And then finally, there is actually a Lancet Commission recently announced, led by Mark Jitt, which will actually do what we have done here, but then on a much larger scale, and taking 3 working groups, which is how should models be governed, how should models be conducted, as well as how should models be communicated. So I think that's something to look out for. Thank you.